Extremely delighted to welcome you to the 39th Annual Scientific Conference and Annual General Meeting of the Kenya Cardiac Society.
It is indeed a great pleasure for me to join you today at this 39th Annual Scientific Conference of the Kenya Cardiac Society.
The Society will try on its part to continue discharging its mandate of improving quality of cardiovascular health care.
The requisite up-to-date and evidence-based expertise and knowledge on cardiovascular disease care that will be presented here during the three-day conference.
A stitch in time saves 9. And so when we approach the whole concept of preventive cardiovascular medicine, we're asking ourselves, what is it that we can do beforehand, before our patients begin to develop what we would call major cardiovascular events?
Hypertension or elevated blood pressure is an asymptomatic disease. You don't know whether somebody has got hypertension or you have hypertension until it is measured.
Then we need to proactively exclude pseudo-resistance.
Recent paper saying 1 out of 7 for those who have syncope, but unfortunately in Kenya we don't know.
We are really looking at the valvular apparatus from the ventricle.
On this apical 4 chamber is giving us an ejection fraction 44. Already that's reduced. Okay, so we do it on the 2 chamber as well. And then we get a summation of the 2.
Yeah, thank you for the good presentation, Dr. Mazo. My question is, sometimes we feel like we are limited as a sonographer. You do an echo, you get the diagnosis. You give your report. So sometimes, depending on who was sent the echo, you feel like somehow you are limited on giving like the recommendation. You see the severity of this echo and where this patient is coming from.
I think there is definitely a moral responsibility on you as a healthcare worker to put there that the features that you find are consistent, the echo findings consistent with severe or whatever aortic regurgitation. Of course, you need to correlate clinically and refer, for valve to cardiologist or for valve intervention.
Difficult to qualify for, so there'll be at least initial limited use, and still probably in centers of excellence that are experienced with treating high volumes of patients with obstructive hypertrophic cardiomyopathy.
So we divide the vega just in 3 stitches. Everything started like that. We put 1 stitch next to the posterior side, 1 in the middle of the anterior annulus, and the other 1 anteriorly. So we did the 3-stitch technique.
Through missions we get connections and people try to donate. So that's where we are at now.
By statistics, we also tend to take on some of the cases which perhaps are passed by. We've done post-infarct VSDs, we've done dissections which previously weren't done, and of course they have casualties even in high volume centres.
We have the outcomes, so you can select if there were any complications. Again, that is also multi-selection that you can have. Or if you didn't have any complications, you can also say there were none.
The approach for angiogram is the one which is recommended because it causes less bleeding and hematoma problem than the femoral artery.
In some patients, in fact, the natriuretic peptides may actually be normal on a background of HFpEF.
Outcomes of CVDs in selected hospitals in Kenya retrospectively for the period January 2018 to December 2020. So we did a retrospective cross-sectional study. We looked at hospital records for both inpatient and outpatient.
My happiness must stay because that's my own private area. You try to take it away, I'll refuse with it. very difficult to control. Sometimes you get upset, but you try to control yourself.
Dr. Kikonyo, in terms of thinking about the holistic perspective to a patient, thinking about the mind, the heart, putting everything together. Just simple psychosocial stressors can cause you significant impairment in terms of your sexual function. So let's look for depression.
The next case, this was a COVID era patient who presented with syncope.
Once again, I asked the team, if this patient comes after 2 days of chest pain, will you do the angiogram first or the echo first, or it depends on what you have in your hospital?
What one would have done, we send the patient for the scans. We still have some issues, but this is gotten from the internet.
I mean, normally with the other measurements, you spend some time, you do about 18 to 19 clicks before you get your ejection fraction measurement. But with this, just 3 clicks.
It is beneficial for all these patients to start on statins, but like the SHARP trial will tell us, there is benefit to the patients who are not on dialysis.
The medication just makes them able to do something they were unable to do before, and then they collapse.
Thank you, thank you. So we'd like to appreciate our speakers today for those special moments, the talks we have, the discussions we've had.
Thank you very much for attending this year's Kenya Cardiac Society Annual Congress. I think it's been a great time for everyone. I think yesterday at the gala, people have had lots of fun.